the entire body for severe bleeding as you continue care. The care you provide depends on what conditions you find. If, when you give the first 2 rescue breaths during the initial assessment, the breaths do not make the chest clearly rise, reposition the airway by tilting the head further back and try 2 rescue breaths again. If the breaths still do not make the chest clearly rise, the victim's airway may be blocked. You will learn how to care for a blocked airway later.
If a victim is moving, breathing, and has a pulse, but is unconscious, or if you must leave the scene, place the victim in a recovery position. To roll the victim away from you, kneel at the victim's side. Take the arm farthest from you and move it up next to the head. Take the other arm and cross it over the chest. Then, grasp the leg closest to you and bend it up. With your hand on the victim's shoulder and hip, gently roll the body as a unit, keeping the head, neck, and back in a straight line. Carefully angle the head toward the ground. This will allow fluids to drain away from the throat. Once in a recovery position, the victim should be turned to the opposite side every 30 minutes, or if you notice that the skin of the lower arm is pale, ashen, grayish, or cool to the touch. If you suspect the victim has an injury to the head, neck, or back, use the jaw thrust maneuver. Place your thumbs along each side of the mask and your fingers behind the angles of the jaw. Brace your elbows for support. Without moving the head, apply downward pressure with your thumbs and lift the jaw to open the airway. Give 2 rescue breaths as you learned earlier. If you suspect a head, neck, or back injury, and you cannot maintain an open airway, or if you must leave the scene, place the victim in the modified Haynes recovery position. Haynes is an acronym for High Arm in Endangered Spine and is the preferred alternative for airway and spinal protection for the unconscious, suspected spinal injury victim. To place a victim in the modified Haynes recovery position, kneel at the victim's side. Reach across the body and lift the far arm up next to the head with the victim's palm facing up. Take the victim's nearest arm and place it next to her side. Grasp the leg farthest from you and bend it up. Using your hand nearest the victim's head, cup the base of the victim's skull in the palm of your hand and carefully slide your forearm under the victim's near shoulder. Do not lift or push the victim's head or neck. Place your other hand under the arm and hip closest to you. With a smooth motion, roll the victim away from you by lifting with your hand and forearm. The victim's head must remain in contact with her extended arm. Be sure to support the head and neck with your hand. Stop all movement when the victim is on her side. Bend the knee closest to you and place it on the top of the other knee. Make sure the arm is on top and is in line with the upper body. Monitor the ABCs, airway, breathing and circulation, and care for the conditions you find.
When doing an initial assessment for a child, follow the same steps as for an adult, but you will need to make a slight adjustment in how far you open the airway. For a child, you do not need to tilt the head as far back to open the airway. Tilt a child's head so that the airway is slightly past neutral. Tilting the head back too far can also close off a child's airway. Check for a child's pulse in the same way that you check an adult's, by pressing in lightly on the groove at the side of the neck for no more than 10 seconds.
6 1000, 7 1000, 8 1000, 9 1000.
The steps for performing an initial assessment on an infant are the same as for an adult and child, with 2 exceptions.
Frank, call 911. We got an unconscious baby.
When opening the airway for an infant, you will need to tilt the head back even less than you did for an adult or child. Place an infant's airway in a neutral position. Here, you can see the difference between the head tilt you might use for an adult, compared to a child, and an infant. To check an infant's pulse, keep one hand on the forehead to maintain an open airway. With 2 fingers of your other hand, locate the brachial pulse on the inside of the upper arm, between the elbow and shoulder. Press in lightly to feel for a pulse for no more than 10 seconds. To review, once you have sized up the scene and determined that the scene is safe, put on appropriate personal protective equipment and perform an initial assessment. To perform an initial assessment, check for consciousness. If the victim responds, obtain consent. If there is no response, consent is implied. Summon EMS personnel.
Tina, call 911. We have an unconscious patron.
Check for signs of life. Look for movement and look, listen, and feel for breathing for no more than 10 seconds. If there is no movement or breathing, position your resuscitation mask over the victim's nose and mouth. Seal the mask, open the airway, and give 2 rescue breaths. Check for a pulse for no more than 10 seconds.
4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000.
Quickly scan the entire body for severe bleeding and care for the conditions you find.
10, call 911.
To open a child's airway, position the head slightly past the neutral position.
1 1,000, 2 1,000, 3 1,000.
To open an infant's airway, position the head in a neutral position. Check an infant's pulse on the inside of the upper arm between the shoulder and elbow.
4 1,000, 5 1,000, 6 1,000.